connection, you're live.
Hello everyone, it's Dr. Vidal and we are back with Tuesday Tips. This is our weekly check-in. We discuss different topics of plastic surgery and I get to answer your questions. Today we're continuing our What to Expect series. It goes focused on the patient experience, some things that are usual after each surgery, and we go through all of that, explaining why you go through that and what to expect, why, and what to do to make it better. So today we're going to be talking of what to expect massive weight loss surgery. And you would think, massive weight loss, yeah, but it's still a breast lift, breast reduction, a tummy tuck. Why is it so different? Well, there are some things that are specific to massive weight loss patients that they tend to experience differently because of the journey that they've been through, the type of weight loss, the type of surgery. So that's why I wanted to specifically address the massive weight loss patients today, and we get to answer your questions afterwards. So if you have any questions regarding anything else, we can always go ahead and answer those, okay? Let's start by talking about the timing. So very common question I get is, after my bariatric procedure, when can I go ahead and do my reconstructive or plastic surgery procedure? Two timings are important here. One is the time after your surgery itself, the bariatric procedure. So at least 1 year. Why? Because you're going to go through a lot of metabolic changes in your body and also your weight loss journey, okay? And it is important that you complete that journey before going ahead and passing through to the next step, which is the other timing. So it's 6 months of stable weight, okay? It needs to be both things, okay? If you are 1 year after surgery, but you are still losing weight, you haven't gotten to that stable weight, you should wait, okay? Remember, when we go ahead and remove that excess skin, tighten the muscle, lift the breast, whatever it is that you need, I do it to the weight that you are currently at that moment in time, okay? Which means that if you lose more weight afterwards or gain weight, because with bariatric procedures, there is a normal or usual curve of weight loss, very rapid weight loss, but then you may see a little bit of an increased weight, okay? Sometimes you go ahead and lose 100 pounds, but your stable weight is actually 80-pound weight loss from your original weight, okay? And that's okay. And the nutritionist and your bariatric surgeon are the ones who can help you and guide you to where it is that your goal weight should be. And another topic that is, I think, super important is there is a lot of pressure of what is the weight that we should be. And another one is the weight that we are comfortable maintaining, okay? It is weight, yes, it is a number, but I think the most important part of that is your health, right? And this is the bottom line of the bariatric procedure and this part of the reconstructive part, okay? It is to help you feel better in your own skin, but also to bring your health back, okay? When you are 200, 300 pounds or even more, other things, health conditions come by, right? Diabetes, high blood pressure, cholesterol, increased risk of heart attacks or cardiovascular events. And all of that decreases when you lose that weight. So it's a combination of, looking better, but also being healthy. And when you reach that goal weight, it's important that you can maintain in long term, because it is not good to then go ahead and lose to a weight that you can't maintain and then go back to the weight that you were before, okay? Because it loses that validity. So the maintaining the weight is very important to maintain your results and your health, okay? So that's why those two timings are important, and it's not one or the other, is both, okay? So example, if you reach your goal weight at 6 months after your surgery and you've been stable, but you're still not at a year post-op, you still need to wait, okay? Why? Because of the metabolic protein changes that go in your body that we need to stabilize for you to heal all the incisions that you'll need to heal after your plastic surgery, okay? So multiple surgeries. This is the second one. It is very hard. I know that no one wants to go to surgery multiple times, but I always try to explain in a way that you understand the importance of staging surgeries when there is a lot to reconstruct, okay? When you went ahead and you changed your life and you lost X amount of weight and you have now excess skin in multiple areas of your body. And going ahead, like the same way that it took time for you to lose that weight, it'll take time for us to reconstruct that. And you shouldn't feel pressure to do it rapidly, or you shouldn't feel that it is a downside of it. It is just part of your journey, and you need to understand that to get to the majority of the bariatric patients, to get to their goal image of how they want to see themselves in the mirror, it will take at least 2 to 3 surgeries, okay? Most commonly, which is the one that we usually start with body-wise, is what we call the trifecta, or 3 procedures combined to obviously try to get less anesthesia interventions, less recoveries, but keeping it safe. Those are the 2 most important aspects of determining how many surgeries we can combine, okay? 1 is the safety and 2 is the recovery, okay? So, like I mentioned, the most common one is the trifecta, which is combining a breast or chest procedure in males, gynecomastia, or breast lift with or without implants, breast reduction, with tummy tuck or abdominal reconstruction, and the arms, the brachioplasty. Those 3 are okay to combine, okay? But it is a big surgery, okay? And it involves a big recovery. So plan ahead, have someone that can help you out, or a recovery home or a nurse that you have to help you in the recovery process. Make sure that your vitamins and supplements for your post-bariatric procedure are up to date, and your protein levels are up to date, okay? Because there are a lot of incisions that need to heal, okay? So those 3 are the most common. Which are the other ones that my patients usually come back for? The back lift, okay? Usually either upper back, if you have more rolls in the upper back, or a lower back or body lift, which involves basically extending that tummy tuck incision all the way back to circumferentially, and that lifts the buttock and lower back thigh or posterior thighs as well, bringing that up and removing that excess skin. The other one is the thighs, okay? So thigh lift is a very common surgery. The back lift and the thigh lift need to be separate, okay? If you have the two that you need, or like you have excess skin in both areas that you need to address, it's better to do the back lift first and then do the thigh lift, okay? And the other common one that needs to be separate is the face, okay? So if you want to do a facelift or neck lift to remove that excess skin, should be done separately. The face can be combined, like doing the blepharoplasty or the eyelid surgery with the face and neck, okay? All of those can be done at the same time, but the recovery is very different from the body, okay? So put yourself in the mentality that it'll probably be more than 1 surgery, okay? Skin quality. So very, very, very commonly, after the excision of that excess skin and everything healing, you may feel that you can still like pull your skin. And a lot of patients are like, I don't understand, if I had surgery to remove the excess skin, why am I able to kind of pull it? So after you gain all that weight, the skin had been stretched throughout to its limit, okay? Collagen, elastin, and all the components of the skin have been stretched out. After collapsing that, the skin quality usually never goes back to baseline, which means that the skin elasticity has been lost, okay? So that is why a lot of times massive weight loss patients will need a revision to re-tighten everything. Why? Because after I tighten everything up, there's swelling, and that swelling kind of expands, but because the elasticity it's lost, it doesn't have that ability to recoil and go back. So it kind of remains loose, okay? So don't be discouraged if you see excess skin. Just talk to your surgeon, and revisions in massive weight loss patients are very common because of that, okay? DVT or pulmonary embolism is a very important topic to discuss when we're talking about massive weight loss. There are several reasons why. One is massive weight loss patients per se are at increased risk because of the journey they've been through and the metabolic demands that your body has. And second, because of the recovery, okay? Because we're combining multiple surgeries. Usually one of those is the tummy tuck. Tummy tuck tightens everything in the torso, restricting or slowing that venous return to our heart from the legs, putting us at risk of having blood clots in the legs that can travel to your lungs and become a pulmonary embolism, okay? So there are a few things we can do to try to decrease this risk. One is patient selection or things that we do before the surgery. That is why trying to get your BMI to less than 30 is so important, at least to a 33.5. That's why my upper limit of BMI is 33.5, okay? But I always encourage everyone to try to get as close to 30 or lower than 30, because that's when we see a real decrease in DVT PE complications, okay? The other important aspect of it is our recovery, okay? So I usually don't put my patients in Lovenox or blood thinners after the surgery, but I give you a sequential compression device or VenaPro or Circle 8 device, which is basically kind of a device that you wrap around your calves, massages your calves, and that kind of promotes circulation and decreases risk of blood clots. So every patient that's coming, massive weight loss patient, I'm gonna give this to you to wear for 2 weeks, okay? If you have higher risks like higher BMI, or you're, for example, undergoing a circumferential body lift, I will prescribe the Lovenox or blood thinner for you for 2 weeks, but that brings us to another problem, which is the increased risk of bleeding, okay? So I'll have to be monitoring you more closely, because once we decrease the risk of blood clots, the blood becomes thinner and increases risk of bleeding. So that's why I don't routinely use blood thinners in every single patient. I try to decrease the risk and add the Circle 8 or VenaPro to decrease that risk. And the third and most important aspect of your recovery is moving, walking, okay? So all of these things are going to help to decrease the risk, but the number one is getting up and walking and kind of pumping that blood, moving along. So that is why massive weight loss specifically, that we're doing multiple areas, usually people are like more sedentary and the risk of blood clots is higher. So try to, plan ahead. That's why having a companion or a person that's there with you, helping you out and encouraging you to get up and walk is so important. So every hour you'll get up and walk for 10 minutes, okay? Even the day of surgery, okay? Extremely, extremely important, okay? Scar management is essential in massive weight loss. One is the nutrition. That's why I keep mentioning your protein, your supplements, your vitamin supplements. After bariatric procedures, depending on the procedure itself, either is a gastric sleeve, is a gastric bypass, is a duodenal switch. All of those procedures basically restrict the ability that you have to eat and also change your metabolism depending on the surgery. A bypass, duodenal switch, those surgeries change your metabolism and change the absorption of iron, vitamin B12, and other essential vitamins, zinc, other essential vitamins and supplements that you need to heal, okay? So if you are not before the surgery up to date in your supplements, in your nutritional supplements, and also checking your blood work to make sure that all those levels are good, you're not gonna have a good time healing. Incisions may open up, we can have open wounds that tend to heal with time but take longer, okay? So scar management is essential pre-op with your nutrition, and afterwards starting your scar management at 2 weeks post-op. Silicone-based products are the ones that are very helpful, okay? If you want to try to use other products, there are a ton of products of scar management out there in the market, but the only thing that's been FDA proven to help with scar is silicone-based products, okay? So I've heard, vitamin E, oils, all of these things. Yeah, okay, they won't harm you, but they're not proven. Okay, first the silicone, and then we can do other things if you like to. Okay, and the other one that is extremely important is sun protection. Okay, when the wounds are healing, they absorb more light, they get darker. Okay, so it's very, very important to protect your scars for the first 3 to 6 months, but then up to a year, reapply sunscreen every 2 hours of at least an SPF more than 30. Okay, I'll take some questions now.
Start. Why do
Yes.
patients lose so much blood after a BBL, even with a cell saver?
So remember that liposuction is a blunt procedure. Okay, you're basically inserting a cannula and kind of suctioning the fat. There are a lot of things we do to decrease the blood loss, but when liposuction first arose in the 80s, it was a very morbid procedure, and it was actually like, we need to stop this because people are bleeding out. You're basically suctioning fat and blood. What are the things that we do, and why liposuction became possible was tumescent fluid. Okay, so the first that described this is Dr. Klein. It was actually a dermatologist that basically mixed saline with lidocaine and epinephrine. Okay, I don't use lidocaine because it increases risk of toxicity because I'm doing larger areas and I'm doing it under general anesthesia. Okay, but I do use epinephrine. Epinephrine is a vasoconstrictor. It shrinks or constricts the blood vessels, so when I'm doing the liposuction, it's not bleeding, but there's always some bleeding involved. Okay, the other things that are important is maintaining your body temperature. That's why we use those huggers or blowers with warm air to warm your body. And the other thing is the compression afterwards. Okay, all of those things are important. I use the cell saver to aid on that blood loss that you lost. Even with all these measures, I try to filter that and then give it back to you, so the total blood loss is less. Okay, but never zero.
I'm getting a BBL. Will lose fat on the rest of my body too?
So no, the BBL only removes fat from the areas that I'm doing the liposuction. Okay, the only way of losing fat in other areas of your body is by losing weight. But be careful, because then you may lose the BBL or the fat that was transferred. So it is always better to lose the weight before your surgery, and it depends in your specific case about with your BMI, or what is your body mass index. You calculate with your weight and height to be sure that you are in an ideal BMI for a BBL.
What's the highest BMI could you do for a BBL? And she sends a flower, a little cat, and something that I don't understand what is it, something green and pink.
Okay. So highest BMI is 33.5, okay? But I do encourage you to be less than 30. That's gonna improve your results and also decrease complications.
Oh, this is about the semaglutide. And
Okay.
she asked, why does the shot to lose weight make you sick?
So the semaglutide is a medication that basically decreases gastric emptying. So gastric emptying is your stomach has a time that keeps the food, so it digests the food and then it goes past to your intestines. Your body, while your stomach is full, sends a message to your brain saying you're not hungry, we don't need more food because it's full. So usually gastric emptying depends on the type of food. If it's more carbohydrates, more fats, depending on the contents of your food. But this medication specifically then slows that, makes it slower, so your stomach has food in it for longer periods of time. So that sends a message to your brain saying you're not hungry, you're full, you don't need more. Okay, so basically you eat less, and when you do eat, you eat less amount. But why does it make you sick? Because your stomach is kind of, it's not emptying, okay? So if you are taking too big of a or too much of a dose for your body, it's a very dose dependent on the person. It might be that your stomach is too slow, it's too full all the time, and you may feel bloated, nauseous, okay? So that is why it's so important to start in the lowest dose and then increase it, but slowly, so you can know what is the best dose for you.
Yeah, this is just a message, it's not a question at YouTube. And she said, I'm so glad Dr. Vidal was my doctor 4 weeks ago. Today, my tummy looks, wait, I'm almost there. My tummy looks amazing and still have some swelling that needs to go down.
That's awesome. Very happy for you, and it will only get better. You know, after a tummy tuck, the swelling after 6 weeks decreases a lot, but you may see some decreased swelling up to a year, okay? But that's gonna get a lot better by 3 months.
When performing a brachioplasty, can you go from the armpit to just halfway to the elbow instead of the whole way?
So it depends on where is the excess skin. So basically, if this is your arm here, shoulder, and this is your elbow here, okay? This is the axilla. If your excess skin is mainly, this is the axilla here, right? If it's only here and then it thins toward your elbow, then we can go ahead and stop it here. But if your excess skin goes all the way to the elbow, which is the majority of the cases when we do have excess skin, and I go ahead and just limit the incision to here, then you're gonna have excess skin near the elbow, and that's not gonna look good, okay? So it all depends on where is the excess skin, and that's the length of the scar.
Another comment, Doc, I'm so happy and glad I meet you today. Sadie.
That's awesome. Yes, very glad to meet you too. That's awesome. So thank you so much, you guys, for joining. I hope this helped answer some massive weight loss patient questions, and I'll see you. I won't see you guys next week. I'm going on vacation, but then I'll be back the following with more Tuesday tips. Don't miss it.